Hey there, and welcome to this explainer. Today, we are tackling what's known as the silent liver threat, and we're answering a pretty massive question. Can you actually reverse fatty liver? We're going to dive straight into a fascinating and honestly slightly alarming medical mystery that's happening right inside our own bodies as we speak. We're talking about one of the hardest working organs you probably barely ever think about, your liver. So we're going to explore a growing threat that affects literally millions of people globally, yet somehow it rarely makes the headlines. We'll uncover what it is, how it works, and most importantly, whether you have the power to reverse it. Let's get into it.
So could your liver be in danger right now without you even knowing? I know, it kind of sounds like a hook for a science fiction movie, but it is an absolute medical reality. In its early stages, fatty liver is known by doctors as a silent disease. It's just working quietly in the background, and it often causes zero physical symptoms. None. You might feel perfectly fine. You might be going to the gym, working hard, just living your life. Actually, a lot of people only discover they even have this condition completely by accident. It usually pops up when a doctor orders a routine blood test or an ultrasound for something totally unrelated.
Okay, so what exactly is happening inside the body here? Well, the formal medical term is hepatic steatosis. Now, hepatic just means relating to the liver, and steatosis means the abnormal retention of fat inside a cell. So, simply put, it's fatty liver disease. It happens when excess fat actively builds up inside your liver cells. Now, a perfectly healthy liver does contain a tiny bit of fat, and that's totally normal. But when fat starts to make up way too much of your liver's total weight, that hidden fat accumulation becomes the root of a major metabolic problem. It basically throws a huge wrench into how your body processes energy and filters out toxins. Now, while the disease is usually completely silent, like we said, your body might occasionally whisper for help. There are some potential early warning signs you should definitely watch out for. For example, you might feel this lingering, persistent fatigue, the kind that a good night's sleep just doesn't seem to fix. You might also feel a vague discomfort or a kind of weird sense of fullness in the upper right side of your abdomen. That's right under your ribs, which is exactly where your liver lives. Or you might just experience a generalized, unexplained weakness. Of course, I should point out, these symptoms are super nonspecific. They can mean 100 different things, right? But the absolute key takeaway here is this. If you're experiencing these things, your body is telling you something is off, and you really shouldn't ignore it. To really wrap our heads around this threat, we've got to shatter a massive myth right now. For decades, society broadly just assumed that liver disease was strictly an alcohol problem. But there are actually two main types. Yes, we have alcohol-related liver disease, which is directly caused by drinking way too much alcohol. But the other type, the one we're really focusing on, is non-alcoholic fatty liver disease, or NAFLD for short. This type is mainly linked to things like being overweight, having obesity, insulin resistance, and type 2 diabetes. Think about that for a second. You could literally be a lifelong teetotaler, never touch a single drop of alcohol in your life, and still develop severe fatty liver. It is deeply, deeply connected to our modern metabolic health and our everyday lifestyles. And here is why we need to pay such close attention. This is the terrifying progression if this silent disease is left entirely untreated. It's kind of like a domino effect. Step 1 is simple fatty liver, just that initial fat buildup we talked about. But if nothing changes, it escalates to step 2, which is steatohepatitis. That's just a fancy word for severe liver inflammation. At this point, your immune system is actively fighting the fat. Over time, all that chronic inflammation leads to step 3, fibrosis, which is actual physical scarring of the liver tissue. And finally, if that scarring takes over and hardens the liver, you hit step 4, cirrhosis, and that can ultimately lead to complete liver failure. It is a progressive timeline, and honestly, the stakes could not be higher. But hold on, take a deep breath, because here is the pivot, and it provides a massive sense of relief. The good news? Early-stage fatty liver can often be improved, and in many cases it can be entirely reversed. Seriously. Unlike advanced scarring, which might be permanent, getting an early diagnosis combined with some highly specific lifestyle interventions can physically heal the damage. You literally have the power to turn back the clock, clear that excess fat right out of your liver cells, and restore your organs' health, if you act early enough. So how do we actually pull that off? Well, it starts with a critical number, 7 to 10%. Clinical research strongly shows that for a lot of folks, one of the single most effective treatments is gradual weight loss. Losing just 7 to 10% of your total body weight significantly reduces liver fat and severely drops that dangerous inflammation we just talked about. But, and this is a massive warning straight from the science, you absolutely must avoid rapid crash weight loss. Seriously, starvation diets or dropping weight way too fast can actually stress your liver out even more and temporarily make the problem worse. Gradual, sustainable weight loss is the true medical key here. Next up is another vital target number for your routine, 150. Health experts recommend hitting at least 150 minutes of moderate physical activity every single week. And look, this isn't about training for an ultramarathon, okay? It's about brisk walking, cycling, or maybe some swimming. Consistently getting your heart rate up helps your body burn off that stubborn stored visceral fat. But cardio alone isn't the whole story. The science also specifically recommends adding in strength training. Building muscle vastly improves your insulin sensitivity. That gets right to the root of your metabolic health and gives your liver a huge assist in the healing process. And of course, all this complex clinical science translates straight into your grocery cart. This is your liver healing diet. To actively help clear fat from your liver, you need to eat more whole foods. We're talking vegetables, legumes, whole grains, nuts, fish, and using healthy fats like olive oil. On the flip side, you've got to cut the fuel that's feeding the disease in the first place. That means severely limiting sugar-sweetened beverages, which, by the way, are absolute kryptonite for a fatty liver, as well as refined carbohydrates, highly processed foods, and excessive saturated fat. Think of it this way. Every single meal is an opportunity to literally eat to heal your cells. Beyond your daily diet, you also need a big picture, long-term healthcare strategy. Because right now, there is no single magical pill that's specifically approved to just cure most cases of non-alcoholic fatty liver disease. Treatment heavily relies on managing the underlying conditions. You really need to work closely with the healthcare provider to actively control things like diabetes, high cholesterol, and high blood pressure. Sometimes just managing those associated metabolic conditions with specific doctor-supervised medications can drastically improve your liver health as a powerful secondary benefit. It's all about treating your whole metabolic system, not just one part. And we absolutely have to talk about this next rule. Even if your specific diagnosis is non-alcoholic fatty liver, you still need to limit or ideally entirely avoid alcohol. Why? Well, because your liver is already compromised. It's already inflamed, it's working overtime, and it's filled with fat. Adding alcohol into that mix is quite literally pouring fuel on a fire. It forces your already stressed liver cells to work even harder to filter out those toxins, and it exposes them to even more damage. You have to give your liver a break so all of its energy can be focused entirely on recovery and healing. Okay, so let's say you make all these incredible lifestyle changes. How do you actually know if it's working? Well, healthcare professionals can monitor your liver's recovery over time using a few specific methods. Routine blood tests will frequently check your liver enzymes to make sure the inflammation is dropping. Liver ultrasounds can give you a clear visual confirmation that the fat is actually reducing. And there are even specialized liver assessments that can physically measure the stiffness of the liver. That makes sure the dangerous fibrosis scarring isn't progressing. All of this proves that reversing fatty liver isn't some blind guessing game. It is a highly trackable, manageable health journey. You can literally measure your success. So who really needs to be on high alert here? Let's talk about the high-risk categories. If you have persistent, unexplained fatigue, if you've had abnormal liver blood tests in the past, or if you live with obesity, type 2 diabetes, or metabolic syndrome, you really need to seek a professional evaluation. Please go discuss your liver health with a qualified healthcare professional. Because as we learned earlier, advanced liver scarring, those scary stages of fibrosis and cirrhosis, they might not be fully reversible. The window of opportunity to reverse this condition is right now. Early detection really, truly does make all the difference in the world. Which brings us to our final, lingering thought for today. Is it time you finally checked in on your metabolic health? Your liver does so much heavy lifting for your body every single minute of every single day, and it does it completely in silence. It filters, it processes, it literally keeps you alive. So please, don't wait for it to shout in pain before you decide to pay attention to it. Talk to your doctor, prioritize your nutrition, and get moving. Thank you so much for joining me for this explainer. Stay curious, take care of your incredible body, and I will catch you on the next one.